Thank you, Globex, Dr. Giriraj sir, for giving this wonderful opportunity. Thank you, Chembur Gymkhana members, for being here. So, I would like to talk about few important things before I start. One is I have a very busy OPD, but even on busy day, I end up seeing maybe 20-25 patients. Each patient I need at least 20-30 minutes to see, and by end of the day, I get tired. I cannot see more than 25 patients in a day, and I have to manage the rounds and surgeries also. But remember, these are the events which are very exciting. I feel always like to come to such events because in few minutes we can connect with many people and we can fulfill our agenda of prevention because knowledge is power. Once we know what is heart disease, why it should be taken seriously, why they are rapidly increasing, and how we can control, we will be able to prevent development of heart diseases. We will be able to pick up early. As for cancer also, late stage beyond our control, but early stage we can save a person's life with minimum intervention with less cost. So prevention, detecting early and treating properly is possible if a spirited person comes and participates in a discussion to understand, gets the knowledge, and we are capable enough to change our behavior to be able to achieve certain things. That is one thing. Second thing, why should we take heart disease seriously? Any answer? Two important things. Two important things. Remember, yes, ma'am. Mike, please.
Hello, it's okay. My husband was admitted in Beach Candy Hospital. Just I told Dr. Pelajani that I'm breathless sometimes. He checked and I had 90% blockage. I never knew, no symptoms, nothing. So we can't say. And I'm not fat. They say obesity is the cause. Nothing.
Okay. So, very relevant question. So, that is what our title is. Don't always come with warning signs, do they? So, at the end of the talk, I think we'll have the answer. Why? Your question was I developed 90% block, but there was no symptom, there was no warning sign or signal. Good. So, that tells us the importance of screening. What you did today to screen for the sugars, to check for the cholesterol is the wonderful thing. Okay, I'll come to that point. Your question is very relevant and the most important thing. So before that, why we should take heart diseases seriously? Because of two reasons. So the burden, the people who are dying because of heart diseases is huge number. So combined deaths of cancer plus accident deaths and during the COVID time, the COVID deaths, three deaths together, even less in number as compared to deaths because of heart diseases. So this is the huge amount of burden that we are facing. We are the leading country where young people are dying. So why we take seriously? Because the burden is too much. Our people suffer at younger age, 10 years earlier, severe disease. So there is something which is happening in a wrong way. People say it is because of genetic exposure. But everybody knows my grandfather survived till 90 plus without having hypertension, diabetes. Why we are having? So the answer in this is genetics. So Dr. Snehal talked about genetics. We are exposed to certain kind of diseases, but genetics is like a loaded gun. The triggers are because of our habits. So what we are doing today, what we are eating today, whether we are exercising rightly or wrongly, are the triggers which fire the gun. So even if the genetics is there, we can still dodge the bullet if we stay away from the triggers, the habits. So we have to change our habits. So one point, it is the burden. Second, heart diseases are preventable easily. So that's the reason we should take heart diseases very seriously. So why I say preventable? Let's go through it. Next slide, please. So, so it's the number one cause of death, occurs 10 years earlier. And since there are risk factors which lead to heart diseases, we know which risk factors they are. And it is a slow process. The plaque deposition starts early. It starts since birth. And the results are seen. See, you had a natural process of plaque development. You are now 70 plus. Yeah, 77. So what she had is a natural process of plaque development, and she did not even suffer from a heart attack. Touch wood, God is kind. So she got to know about this at right stage, and she's hale and hearty amongst us here. So this is how the natural process is. But we are treating 28-year-old, 36-year-old, 42-year-old with lot of or acute heart attacks, walking on the roads, walking on the stations, playing in the ground and collapsing suddenly, not even fortunate enough to get the chance to get treated. So we have risk factors and they are slowly progressing. And if we know what the risk factors we have, we can work on that and succeed in preventing a heart disease. So once a disease is established, no, it comes with suffering. The family becomes poor. We end up losing a lot of money, and it is not justified. So what happens in a heart attack? So I'm talking about heart attack. What is it? Can anyone tell me? Yes. So as simple as wherever the demand of blood is not matched with the supply leads to heart attack. That can be because of less supply or more demand, or there is a block in between. The pipe is choked. The demand is there, but so in her case, body balanced itself. Look at her profile. She is not obese. The demand itself is less. So body adapted. So this is how. So one more question, very important. Lot of people say, "Ki doctor, I am exercising every day for last 5 years. I am walking for 40-45 minutes daily. Still, I suffered from a block or a heart attack. Why? People are there who are doing everything and still they are fit and fine, apparently. So the difference is in outcome. Those people who exercise, who try to stay fit, they survive a major heart attack easily. So outcome is a significant difference. You have to understand that. So don't get disappointed ki somebody is developing hypertension, somebody is developing the sugars are going up. I am exercising. Despite of that, this is happening. The difference is in outcome. So we have to keep doing and following good habits so that we prevent the disaster, prevent the sudden deaths. Okay. So heart attack means the blood supply is less than the demand. Most common reason is a blockage in the blood vessel, choke up. The choke up is happening because of plaque deposition. The plaque is content of cholesterol, lipid. It starts at birth. It's a very slow process, and it is usually seen in 65 plus people, but in our country we are seeing in 40s because of aggravated issues with the lifestyle, as Rohit discussed about the lifestyle issues. So one is that most common, 80%. But there are other reasons for heart attack also, which we call type 2 heart attack. Type 2 means which are seen in marathon runners. I'm going to show one case of marathon person. People who are fit and fine, no risk factor, running for 40 kilometers, 21 kilometers. And even I have treated, being at Bombay Hospital, every year the Tata Marathon happens in a vicinity of South Mumbai, in near around Bombay Hospital. So we happen to treat 4 to 5 cases every year, unfortunately. So one radiologist dropped unconscious. It was his fourth marathon. Despite of that, he suffered from a heart attack. And the reason is he was running too much. He was crossing his maximum heart rate for a longer duration. So we have to understand the heart rate. Heartbeat की संकल्पना सर ने बोली है, limited है, we should conserve. उसका भी I'm going to tell you the correct reason. So when the heart rate is too fast, okay, the demand is too much, heart is not getting time to relax, so heart is beating like this. It needs to feel also before it contracts, so that feeling time gets compromised. So less and less blood is coming, less blood is pumped out. So there is a mismatch in the supply versus the demand that leads to heart attack. So blockage is the most common reason, but without blockage also people suffer from heart attack, especially those who are smokers, those who are eating a lot of oily food, especially the red meat. The blood is high, the viscosity is high, and drinking less water, another common reason. It leads to clot formation easily. So these are the way the heart attacks happen. Then what are the symptoms? So this is one diagram. We can show the cut section of the blood vessel. Blood vessel is like our tube, the pipe which is supplying water to our houses, and there is deposits happening within the blood vessel which choke the lumen and reduce the supply when it is required, and it leads to myocardial infarction, that is a heart attack. The heart attack can be minor to a massive. The presentation is sudden cardiac death, sudden. So the data says 40 to 50% of the people, so 1 in 2 will not reach hospital if they suffer from a massive heart attack. So that's the reason we have to take this seriously. We may not get time. The first symptom itself can be sudden death. So we have to take the heart disease seriously, know about it, understand how to prevent it, understand how to detect it early, and get it treated. Next slide, please. So what are the symptoms? Typical chest pain जो फिल्मों में दिखाते हैं, यहाँ suddenly दर्द हो गया, collapsed. But chest pain typically is in the center. A person won't be able to locate, हाँ सर यहाँ पे हो रहा है. Lot of patients come to us, months से chest pain हो रहा है, and they say this exactly this point. The moment they point it out, I am relaxed. I know this is non-cardiac. Because heart का दर्द जो है वो localize नहीं कर सकते हैं. It is a visceral pain. It is in the center. ऐसा लगता है कि कुछ तो tight हो रहा है. I am not able to breathe. Choking sensation हो रहा है. It may radiate to left arm. That is a typical, but it can be there on the right side also. This plus right is very specific, so don't neglect if it is happening. So typically we see heart attack pain between jaw to belly button, umbilicus. This is the area of distribution and both arms. So I had one patient referred by a neurologist. The patient used to walk and felt pain in the shoulders. He was getting treated for cervical spondylosis for months together. No relief with medicines. I asked him one thing, when does the pain happen? He said, whenever I'm walking and taking few steps, the pain is there. The moment I rest, relieved. So I did one experiment. I gave him sorbitrate. I told him, sorbitrate is a medicine which we keep below the tongue if there is a anginal chest pain, just to prove my point. So I said, ki you start walking. My clinic is on first floor. I asked him to come climbing the stairs. He started having that shoulder pain. I gave the sorbitrate. He took immediately within 30 seconds, the pain relieved. So that proved my point. He had angina. So this can still be a heart pain. Understand that part. So this is the common thing. Can this be acidity related pain? Because acidity pain also happens in the center. How we differentiate? Now, few points. I hope everybody sitting here has taken one or the other type of antacid in their lifetime. And it is easily available. Go to the chemist, tell them I have acidity, doesn't even blink the eyes and gives the medicine. Take this. This is commonly available. It has become over-the-counter available medicine. Acidity medicine, once you take, it gets relieved and you get relief for at least 4-6 hours. At least 4-6 hours. But the heart pain will not be relieved with acidity medicine. Understand that fact. अपने इंडिया में क्या होता है कि मैं कार्डियोलॉजिस्ट हूँ और हार्ट अटैक का पेशेंट शुड कम टू मी विद इन गोल्डन आवर. गोल्डन आवर इज 3 आवर्स. लेकिन आते कब है? चौथे दिन. क्या होता है? पहले दिन पेन हो रहा है. इंसान सोचता है मेरे को हार्ट अटैक हो ही नहीं सकता है, मैं तो अच्छा हूँ, मेरे को क्यों होगा? वो बोलता है ये एसिडिटी है, कल मैंने वो पनीर की सब्जी बहुत खाई थी, एसिडिटी हो रहा है. तो वो क्या करता है? वो जीरा वगैरह का होम रेमेडी बना के पी लेता है. नो रिलीफ. फिर वो किसी को पूछता है अपने पहचान वाला जिसको कोई मेडिसिन चल रहा है, हार्ट अटैक हुआ है, वो बोलता है ये पेंटोसिड ले ले, इससे मेरे को रिलीफ मिला है. ही टेक्स पेंटोसिड, नो रिलीफ. दूसरे दिन वो अपने फैमिली डॉक्टर के पास जाता है, जीपी के पास जाता है. जीपी उनको देखता है, मेडिसिन देते हैं, ईसीजी करने के लिए बोलते हैं. वो ईसीजी करके घर चले जाते हैं. फिर रात को रिपोर्ट आती है ईसीजी की और वो सेंटर से फोन आता है, आपके ईसीजी में प्रॉब्लम है, जल्दी जाओ. फिर तीसरे दिन वो फिर अपने फैमिली डॉक्टर को मिलते हैं और फैमिली डॉक्टर बोलता है अभी आप ये डॉक्टर के पास जाओ. पेशेंट डॉक्टर के पास नहीं जाता है, स्पेशलिस्ट के घर जाता है. फिर सबसे पूछता है, रिश्तेदार से पूछता है, अपने दूसरे डॉक्टर से पूछता है कि मैं किसके पास जाऊँ, कौन से हॉस्पिटल में जाऊँ. सो वी आर लूजिंग टाइम which should be avoided absolutely. So patient comes to me on an average day 3 or day 4, which is wrong. Should come early. So understand, respond. वो जो inner voice है, जैसे गिरिराज सर ने बोला कि अपने अंदर कुरुक्षेत्र है, बन सकता है, कभी भी बन सकता है. अपने अंदर कौरव है, पांडव है, अपने अंदर कृष्णा भी है. वॉइस है विच इज गाइडिंग यू कि बॉस चेस्ट पेन हो रहा है, 80% हार्ट का नहीं रहेगा, एसिडिटी रहेगी, बट ईसीजी कर ले. चुपचाप जाके ईसीजी करो. सिंपल टेस्ट है, कॉस्ट भी नहीं है उसको. नो रिस्क इन दैट. गेट वन ईसीजी डन. 60% ऑफ द हार्ट अटैक कैन बी पिक्ड अप ऑन ईसीजी। नहीं होता है, आगे टेस्ट है, ईसीजी के बाद 2D को है, स्ट्रेस टेस्ट है, विल डू द ब्लड टेस्ट है ट्रोपोनिन की, हम पता लगाएंगे किसी भी तरीके से। बट चेस्ट पेन एसिडिटी मेडिसिन से नहीं रिलीव हो रहा है, टेक इट सीरियसली। सेकेंड पॉइंट वेरी इंपॉर्टेंट, आपको पेन हो रहा है और बैठे हो आप कंफर्टेबल हो, जब भी चल रहे हो, काम कर रहे हो, सीढ़ी चढ़ रहे हो, साइकिल चला रहे हो, पेन बढ़ रहा है। एनी एक्टिविटी विल इंक्रीज द हार्ट रेट। हार्ट रेट बढ़ रहा है मतलब क्या है? ब्लड की डिमांड बढ़ रही है, बट ब्लॉकेज रहने की वजह से सप्लाई ब्लड का नहीं बढ़ रहा है, तो क्रंच बढ़ रहा है। क्रंच बढ़ रहा है तो पेन सीवियर होगा। रिमेंबर दिस फैक्ट। एसिडिटी मेडिसिन लिया, नो रिलीफ, चलना फिरना है, एक्सरसाइज है, एक्टिविटी है, पेन एग्रेवेट हो रहा है, रिपोर्ट इट, दैट हैज टू बी कार्डियक। कैसे डिफरेंशिएट करेंगे? ये 2 पॉइंट से, एसिडिटी का है या हार्ट का है। और हार्ट का प्रॉब्लम जो है, एंजाइना जो है, इट इज एसोसिएटेड विद फ्यू मोर सिम्टम्स। थकान हो रही है, स्वेटिंग हो रहा है, ब्रेथलेसनेस है, सांस फूल रही है, चोकिंग जैसा लग रहा है। So these are the associated symptoms. Chest pain is not in isolation. It is always associated with these other symptoms which come as their friends in bad deed. Next slide. So these are the typical symptoms. Atypical symptoms क्या है? There is an entity called silent heart attack. Silent heart attack सच में silent होता है? No. It is called silent because pain नहीं है. But there are other symptoms. थकान हो रही है, कल तक तो मैं 40 मिनट्स चल रहा था, स्विमिंग के 4 लैप कर रही थी, आज मेरे से नहीं हो पा रहा है, थकान हो रही है, सांस चढ़ रही है, धड़धड़ हो रही है। सो दीज आर द एटिपिकल सिम्टम्स। फटीग, टायर्डनेस, हमको नहीं पता चलता है। सो दिस इज अ साइलेंट इस्केमिक, एंड साइलेंट इज वेरी कॉमन इन हु आर लॉन्ग स्टैंडिंग डायबिटीज। 15 साल से 20 साल से डायबिटीज है, नर्व्स खराब हो गई है, पेन ही नहीं रिपोर्ट हो रहा है बॉडी में, एंड इन वेरी एल्डरली पीपल। So we have to pay attention to these symptoms. And why young people are at risk? Some time ago we were discussing about vaping. Vaping has a it is a known potential to increase the heart disease risk. Then stress plus poor sleep. This is a typical question in my OPD. हर पेशेंट के फैमिली मेंबर मुझे पूछते हैं, सर इसको स्ट्रेस की वजह से ही हुआ है। मैं बोला स्ट्रेस की वजह से डायरेक्टली कैसे होगा? व्हाट इज स्ट्रेस? इन टुडेज एरा everyone is experiencing stress because our expectations are too high. We have limited resources and we difficult to match what we want. तो स्ट्रेस तो हर एक के लाइफ में है, लेकिन स्ट्रेस से क्या होता है? We don't eat on time, we skip healthy food, we don't exercise regularly. हम एक्सरसाइज भी कर रहे हैं, अभी एक्सरसाइज छोड़िए, खाना खाते वक्त हाउ मेनी ऑफ यू सिट रिलैक्स 10 मिनट्स, मोबाइल नहीं है, टीवी नहीं है, और शांति से उसको एंजॉय करके खाया है? See, so this is the natural selection. See, they are hale and hearty today also because they are eating well. वो स्ट्रेस की वजह से हम क्या खा रहे हैं और कितने मिनट में खा रहे हैं सोचते भी नहीं है। और खाना पचाने के लिए वी नीड अ सेरेब्रल फेज। सबसे पहले उसके बारे में थॉट आने चाहिए कि अरे मेरे को ये खाना है, आई लाइक दिस, तब गैस्ट्रिक जूसेस सीक्रेट होने लगते हैं, देन यू डाइजेस्ट इट। वी आर मिसिंग ऑन दैट, सो स्ट्रेस कॉजेज दिस। अपना नींद खराब हो रहा है। सो फूड में 3 पॉइंट रहते हैं। राइट फूड which is low glycemic index, high fiber containing food, right portion. मैं बोला banana is a good food. It is a fruit. It has rich in minerals. Can you eat 4 bananas at 12 o'clock in the midnight? Right time, right food, right time and right portion. ठीक है? So हर एक का लिमिट रहता है। स्नेहल बोल के गया, उसने बोला कि फ्रेंच फ्राइज भी खाने हैं, बट I'll say it is not for us. Limit may be 1 French fry. और practically we cannot control that. Once we see something, before अपना mind हमको रेड अलर्ट दे, 3-4 तो खा ही लेते हैं हम लोग। So it is always better to stay away from these sin foods which are having rich source of carbohydrate. They are high glycemic index and poor in fiber containing. So this is how the food is. So stress leads to disturbed लाइफस्टाइल हैबिट्स, स्लीप खराब हो गया, खाना खराब हो गया, एक्सरसाइज नहीं कर रहे, दैट लीड्स टू हाइपरटेंशन, डायबिटीज एंड हार्ट अटैक्स। देयर इज विसरल फैट, देयर इज अ कॉन्सेप्ट कॉल्ड टॉफी। अभी यहाँ पे बहुत सारे लोग हैं जो एकदम बॉडी मास इंडेक्स 22 है, आइडियल इट शुड बी बिलो 23, आइडियल है, बट वो किसकी वजह से? मसल मास ही नहीं है। जो भी वेट है वो फैट की वजह से है। and the fat is distributed in this area. So typically, Indian people have fat distributed here. This is because of high carb content in the food, low exercises. So we have to change to superfoods, which will increase our BMR, which will help us reduce the visceral fat. Visceral fat is dangerous, and there are ways to reduce it. There are ways to detect it by simple method. हम लोग BMI calculate करते, but not the accurate one. Now new index has come, BRI, Body Roundness Index. It takes into consideration the waist circumference. Start calculating. It should be uh, BRI has to be in control. Then another parameter is TYG index. So today you are checking the sugar cholesterol. Look at the triglyceride glucose index. It should also be in control. So I have seen many people who are exercising, marathon runners, still they are suffering from diseases because this visceral fat. Yes, ma'am. Yes. So visceral fat मतलब क्या है कि viscera is known for body organs. अपने बॉडी में जो हार्ट है, किडनी है, लिवर है, इंटेस्टाइन है, ओमेंटम है, उसमें फैट डिपोजिशन होता है. मस्ट द फैट. सो आप सोनोग्राफी करके देखते हैं, फैटी लिवर है, दैट इज अ विसरल फैट. हम लोग 2D को करते हैं, इपिकार्डियल फैट है, हार्ट की मसल इतनी है, उससे डबल तो उसका फैट पैड है. So we need investigation for that. But what you can do is calculate the West hip ratio. Your West hip ratio should be below 0.8. My West hip ratio male should be below 0.9. ऐसा नहीं होता है. वेस्ट अगर इतनी हिप इतना है तो वेस्ट भी उसके कंपैरिजन में है. So West has to be less. So that West hip ratio is going to give a pointer towards visceral fat. Very simple. Just take a measuring tape, enough to understand whether you have visceral fat or no. Then there are genetics and diabetes. Smoking, no exercise, hypertension, diabetes, obesity, hyperlipidemia. These are the risk factors. And you tell me how many of our young people are balancing consistently. We are exposed to chronic calorie excess. अभी मैं क्लब में जाता था, सब कलकत्ता में जब था तभी, तो वहाँ पे एक विक्टोरिया मेमोरियल है. सब इंडिया के जो रिचेस्ट बिजनेसमैन है वहाँ पे अपना मर्सिडीज पार्क करते थे, राउंड लगा के वो शर्मा जी की चाय की दुकान पे आते थे, वहाँ पे निमकी और चाय पीते. मैं वैसे ही कैलकुलेट कर रहा था कि ये बंदा 5 किलोमीटर दौड़ता है, 350 किलो कैलोरी खर्चा करता है. एक चाय, डबल शुगर, 250 किलो कैलोरी अंदर गई. निमकी खाया 50 ग्राम, 300 किलो कैलोरी अंदर गई. मतलब खर्चा किया 350 किलो कैलोरी का, खाया 500. वेयर इज द अकाउंटेबिलिटी? So this leads to chronic calorie excess. इसलिए मैं बोलता हूँ food has to be right, low glycemic index. So chronic calorie excess leads to plaque, the fat deposition and plaque formation. हमको ये समझ में नहीं आता है. Over a period of 18 years, we suffer from that illness because we don't introspect. We don't audit our food. We don't audit our habits. We need 2000 kilocalories. We are eating to 2200 kilocalories. That 200 kilocalorie energy is not going to be wasted. It will be deposited inside the body. That leads to issues. Next, please. So all people should get checked, assess the family history. अभी मेरे पास आते कि हमें पीपल से प्राउडली मेरे पापा को डायबिटीज अर्ली एज में हुआ, मेरे को भी हुआ. उसमें क्या है? अरे भाई, यू आर फेल्योर. तुझे पता था कि आपके पिताजी को कम उम्र में डायबिटीज शुरू हुई. यू नो हाउ टू प्रिवेंट डायबिटीज, यू नो हाउ टू डिटेक्ट अर्ली स्टेज, यू स्टिल एंडेड अप ऑन इंसुलिन. यू आर अ फेल्योर, सच अ शेम. मतलब आपको फैमिली हिस्ट्री है, पता है, यू वर्क ऑन दैट. इट इज प्रिवेंटेबल. प्रिवेंट इट. दैट इज द डेफिनेशन ऑफ सक्सेस इन माई आईज. Check the blood sugar, cholesterol, get the ECG done. And ma'am, as you said, there were no symptoms. We do the stress test. Stress test picks up. Sometimes stress test not possible. We do CT scan, CT coronary calcium score. Based on that, we go ahead with the other investigation. So, yes, sir. See, in our lifespan, the alarm bell in regard to the cardiac disharmony, in regard to that, the alarm bell is ringing when you hear the words blockage. Now, it is said that even triglycerides or cholesterol does not necessarily very audible. Yes, yes. Triglycerides or cholesterol, etc., Hmm. So, very good question, sir. And this is the exact reason we are here discussing. You understand, detect early, prevent it. Fair and simple. So, cholesterol doesn't mean block. Cholesterol years means block. So, there is a concept called cholesterol years. अभी cholesterol year मतलब क्या है कि मान लीजिए दो लोग हैं ए और बी. ए का कोलेस्ट्रॉल 160 है लेकिन उसकी एज 60 है. बी है पर्सन जिसका कोलेस्ट्रॉल 250 है बट उसकी एज 40 है. बोथ आर एट सेम रिस्क ऑफ डेवलपिंग ब्लॉकेजेस. So what is the level of cholesterol and for how many years it remains uncontrolled leads to plaque formation and blockage. तो इसीलिए we have to stay fit and make sure that it is controlled. मैं ये नहीं बोल रहा हूँ कि आप मेडिसिन शुरू करो हाई कोलेस्ट्रॉल है तो. फर्स्ट स्टेप इज always starts with diet. Second is exercise. They should go together because diet and exercise are the two ends. एक को ब्लॉक करोगे दूसरा ओपन है, it is not going to help. So they both has to be in control. Okay, so cholesterol means a risk factor to develop blockages in future. How many years depends on the cholesterol years, how high the level is, and how other risk factors are. Smoking add kariye. I'll show one case. I want to show that case. Go to the next case quickly. So basic test ho gaye. Prevention ke 5 rule: no smoking, daily activity, control BP, sugar, good sleep, annual checkup. Simple.
Sir, I have a specific question. I'm 59 years old and I'm a elite sportsman. And I basically play badminton, which is a high intensive sport. And I still play at a competitive level. So I have two questions. Initially what you touched upon about an athlete suddenly collapsing on the, and we've had a few cases on that front. Second is when we are playing a high intensive game like badminton, for example, I wear a, I have a watch which monitors my pulse rate, and so frequently, I mean, during very high intensive rallies, the pulse rate does touch, let's say, around 175, 180. So my question is, of course, it comes down because I am, during that time, you feel slightly breathless because obviously you're out of breath when you're playing a very high intensive rally. So my specific question is, so how does one judge, like a correlated question to what you said, is at what point are you at risk? Because we sports people believe then generally that this can't happen. And the second question attached to that is, which you touched upon initially, there is this slight worry that at the first possible recognition of the signs that you are in trouble, you rush to a cardiologist, and next thing you know, you're being advised a block and a stent and a balloon, and you're into surgery. There is this big inhibition. So two specific questions that for an athlete like me, what is the right time to, and what kind of signs to recognize, and therefore how does one get rid of the inhibition of getting yourself checked? Sorry,
Okay,
longest question.
good question. So before I answer about the heart rate, let me clarify the context. So sir asked about the heartbeat concept. It is very relevant. Don't discard it. अपने लाइफ में लिमिटेड हार्ट बीट्स है एंड एक्सरसाइज में बढ़ जाते हैं. वी आर लुकिंग एट 30 minutes ऑफ एक्सरसाइज बट वो उससे बेनिफिट क्या होता है आपका रेस्टिंग हार्ट रेट कम्स टू 60. यू सी ईच एवरीवन रेस्ट एंड टेक द हार्ट रेट. ही इज एथलीट, उनका हार्ट रेट रहेगा 58 60. करेक्ट. those people who are not exercising, overweight, smoking, heart rate has to be 80 plus. तो आपका जो 24 घंटे का उसमें से 30 मिनट निकाल दीजिए, बाकी के जो 23.5 hours है, the heart rate is high, it is beating at higher rate. You are forgetting conveniently. So exercise helps your basal heart rate to stay at lower level. There are athletes who are training heavily for Olympics, their heart rate is between 45 to 50. Okay, so this is the basic context. Your heart rate with exercise should come at base around 60. Mine remains around 60 to 62. Whatever I'm talking to you, I follow in my own life. Now, coming to the risk zones of heart rate. So, since you are using a smartwatch, you know there are apps which give you HR zones, heart rate zones. So, there are zone 1 to zone 5. Zone 5 is the red zone, which is, so there is a concept another is the maximum heart rate. Maximum heart rate is calculated by deducting your age from a fixed figure of 220. Suppose your age is 40, the maximum heart rate that your body can go up to is 180. Okay, so you have to reach 85% of the max heart rate while exercising. When you are doing intense activity, once it is crossing 85%, you cannot stay in that zone. That is the zone 5 anaerobic zone, where the body mechanisms work differently. They are unpredictable. Once the acid level, the lactate acid goes up, the heart may behave erratically, the calcium may go down. So many things happen, and it can lead to a heart attack or a collapse. So HR zone 3 and 4 are the best zones to exercise. How you prevent going to 5 is consistency. Once you consistently exercise, every next day, you will be walking more, but the heart rate is not going up. There are people who are going to stage 5 of stress test and the heart rate is still not achieved because they are well exercising. So this is called conditioning. So your body has to be conditioned before you take up a high intensity activity. If you are not conditioned, you are at risk of developing an health issue, a health scare. And regarding the signs, a person who is exercising, he may not develop the signs. That's the reason we talk about annual checkup, we talk about evaluation. And that last case I'm going to show, I'll discuss on that point, why we evaluate. Go to the next slide, please. Next slide, please, then they. Annual checkup, does it detect the blockage? Because I do not want to get alarmed. So, sir, correct. I want to tell you one thing. As a cardiologist, I don't want to see a blockage. I want to see a healthy person who is transitioning from a health zone to a risk factor zone. And there I want to work, prevent the risk factors, control the risk factors so that no blockage is developed. That is my concept. I don't want to see a block. But yes, that is a cascading effect. You come to me, I'm seeing you. You have severe visceral fat here. I'm going to check the BP. I'm going to check the BMI. I'm going to see whether you have sleep apnea or no. I'm going to see what the sugar level is. I'm going to check the cholesterol level. This is all is going to give me your risk profiling. And based on the risk profiling, if it falls in moderate risk, I'm going to go for the CT angiography. That will tell me whether you have blockage or no. If it is high risk, I'm not going to send for CT. I'm going to take you to cath lab, because prevention, timely treatment is going to prevent an episode of sudden cardiac death, sudden cardiac arrest. You fall in low risk category, I'm not going to do CT also. I will make sure that you are motivated enough to change your lifestyle in a better way. So this is how we categorize, risk strategize. We need triage because we have less number of facilities and wide population. So these are the important things when you do during the heart attack. Boss, don't wait, don't do the home remedies, don't wait for your relatives to inform. कभी कभी आपके डॉक्टर है, आपके कार्डियोलॉजिस्ट है पहला जाने सर, उनको मैसेज डाल दिया, सर बिजी है कैथ लैब में यार किसी मेडिकल कॉन्फ्रेंस में, रात तक उन्होंने देखा नहीं. डोंट वेट, यू फील एनीथिंग, you report to the nearest hospital, get the ECG done, avoid self-diagnosis and home nuskas. Very crucial. Reach hospital immediately. It may be just a silly thing. It may be muscular pain. It may be magnesium going down, and that is what is causing the muscular twitching and pains. But better to be safe than sorry. And golden hour saves lives. This is the basic rule. Next. Yes, ma'am.
Other than cholesterol, some
Yes.
like
So these are rare things which we don't talk on common forums, public forums. These are the entities called vasospasms. So some category of people who are very much emotionally disturbed, the blood vessel goes in spasm. Okay. What is spasm? I'll tell you easily. Winter season में हाथ ठंडे पड़ते हैं. क्यों पड़ते हैं? Because temperature affects our body. Temperature affects the general tone of the body. The blood vessel goes in spasm. Blood vessel का जो diameter है, see, आपके घर का जो pipe है, that is fixed diameter. 4 इंच का pipe है, उतना ही रहेगा. Heart और body के जो blood vessel है, they are dynamic. God has made a wonderful thing. If required, it can dilate. If not required, it can constrict. So because of that temperature effect, it has that effect. So similarly, because of certain emotional outburst, so there are heart attacks called broken heart syndrome. I have seen heart attacks, maybe 1 of 20 are broken heart syndromes. Emotional trauma. One old lady, no risk factors, from a village, she suffered from a massive heart attack, heart failure. The heart pumping had gone to 20%. Why? Because she heard the news, her son got an appointment later. So that was a positive news, but the emotional outburst was so intense, it led to a heart attack. But it is usually reversible. People do recover. We need to support in ICU for a couple of days or weeks time and they recover. So there are other reasons, other type of blockages also, but they are reversible, fortunately. We need to support during the critical phase.
Hello?
Hmm?
Hello?
Calcium comes in the late stage of the blockage formation. So it is hardened plaque. It comes with ongoing uncontrolled risk factors for many months. अगर कैल्शियम है तो हम बोलते हैं कि कम से कम 3 महीने से ब्लॉक चल रहा है, उससे ज्यादा. So it tells us the chronicity, the time duration, nothing else.
Hello, doctor. If we have chest pain, can we walk and go to the hospital? Or if I'm having chest pain, can I walk and go to the hospital? Will that increase?
Again, if you have chest pain, watch whether you have breathlessness, sweating, और 2 कदम चलने पे बढ़ रहा है क्या. अगर बढ़ रहा है, ask someone to carry you. Otherwise, don't. So it is, you are the best judge. My suggestion will be avoid. अगर मेरे पास chest pain का suspected patient आता है, तो I have a wheelchair in my clinic. Hospital is just across. I make sure that my people are carrying the person with suspected heart attack on a wheelchair. I don't want to aggravate the heart rate and lead to aggravation of the heart attack. So this is a very important diagram. This is a new technology. This is what is science is helping. This is how the science is helping us. This is called optical coherence tomography. This is a photograph which is taken from within the blood vessel of a living person. So this belongs to a person who is 42-year-old who was running to a Matunga marathon, which happened to on 29th of March. There was a marathon happened, and this guy, who is a regular marathoner, went for that. The difference this time was, for 1 month he had some leg injury, was not practicing. He went without 1 month's practice, just 1 month's practice, and he came with a massive heart attack. The heart attack was not because of a fixed block, but because of a blood clot formation. ब्लड थिनर्स दिए, सेटल हो गया, एंजियोप्लास्टी की जरूरत नहीं पड़ी. लेकिन अंदर क्या था? सो दिस इज अ थिन कैप फाइब्रोथ्रोमा. मतलब जो प्लाक डिपोजिशन है, पॉइंटर है किसी के पास? सो ये जो ब्लैक दिख रहा है, दैट इज अ फैट, नेक्रोटिक कोर. फैट एकदम सॉफ्ट रहता है, कभी भी ब्रेक हो सकता है अगर शेयर फोर्स चेंज होता है तो. उसको कवर करने वाला जो फाइब्रोसिस का लेयर है, इट इज वेरी थिन. सो दिस इज अ रिसेंटली डेवलप्ड प्लाक, मे बी कपल ऑफ वीक्स टू मंथ्स. वो इट इज एट हाई रिस्क ऑफ रप्चर, क्योंकि उसको कंटेन करने वाला लेयर इज वेरी थिन. ठीक है, और दिस इज द क्लॉट. This is how the clot will be seen. So this is a smooth lumen. You see this irregularity. This is how the blood clot is seen. This is dissolved. Residue is only 5%. जब उसको heart attack महसूस हुआ, it was 100%. It responded to blood thinner well, gone away. So percentage wise, it is 44% block. Not critical, but still suffered from a heart attack. क्यों? He did not prepare for 1 month. उसका शुगर देखा, प्री डायबिटिक रेंज में आ गया था. उस दिन शुगर स्पाइक हो गया था, स्ट्रेस की वजह से है, whatever. He drank lot of liquids to keep hydrated, which are again unhealthy things. So this is what I wanted to show you. What happens when a person runs or exercises without preparation, without understanding his own risk profile, without working on that. So even if you are starting exercises, boss, don't do the marathon like preparation on day one. Start with 30 minutes slow walk. 3 दिन जाने दीजिए. You feel better. Then you gradually step up. That is what prevents a catastrophe. We are doing slowly, gradually, in controlled fashion. That is what the key for sustenance and avoiding a heart attack. Next slide, please. Next slide, please. Yes, sir. इसके पहले का एक स्लाइड पीछे ले लो. नो नो, हाँ. हाँ. Yes. So see, blood vessel we image, no, there are different segments. They are not at the same segment. So different segment have different percentage of the fat content. कम एरिया है. It is one quadrant, no, 90 degree quadrant. You see one quadrant only out of the 4, but still it ruptured, no, it led to clot formation. That is what the reason for heart attack is. It is not the percentage blockage at one point. It is about the clot which was choking the vessel acutely. The young hearts are not prepared to take this. They die suddenly because of these events. So there are many things which increase the viscosity. There are triggers which cause the rupture of the plaque, and hyper viscous blood with ruptured plaque, disaster. Next slide, please. Next slide. So some are biologically dangerous plaques waiting to rupture, especially in young people. Exercise can be a trigger, and we have to find the hidden vulnerability. Okay, so there has to be consistency in exercises, especially who are doing high intensity workouts. You got your answer, sir? Thank you. Next. So recovery is possible. So there are hopes. There is always a silver lining. Okay, early treatment, early detection, steps, right step for prevention. Monitor whether you are doing enough or it is not enough, and be sure about it. You will be able to achieve a good prevention, a good recovery from a heart attack, and lifestyle change is critical. So I'm not saying you need medicine. I am saying you start with your diet, with your sleep, eat mindfully, exercise regularly. This is what is the key for sustenance for 100 years. And in my definition, you have to have a healthy life, cross 100 years without being dependent for the care. That is what the success of definition is. Not earning money. You are earning money, it is a mean to achieve something. That something is a healthy life for 100 years. Next slide, please. Next slide. So my take home message is heart attacks can be silent, they always whisper. So it is a myth that there are no warning signs before a major heart attack. There is a whisper of sign, symptom. You have to pay attention to that. Don't neglect at early stage, otherwise you will end up with a critical illness in a serious condition. So they are always whisper before they shout. Don't ignore the symptoms, and prevention is in your hands. So we are there to guide you. We cannot change your destiny. We can just help you change your own destiny in your own hands. Next slide, please. Next. So there are common questions. Can fit people get heart attacks? As I showed, yes, because our definition or understanding of fitness is not complete. People don't know what is fitness. They look at the surface, they don't look inside. They may be unfit. They apparently are fit. Inside, they may be unfit. Is acidity same as heart pain? No. I told you two things to differentiate between acidity pain and a heart attack pain. Do young people need checkups? In fact, they are the people who need checkup because prevention takes time and it should be started early. Is any angioplasty a permanent cure? No. Angioplasty is a palliative therapy. It is just resetting your clock, alarm clock to zero. Once angioplasty is completed, you step out of the hospital, the clock starts ticking because of the habits. So we have to change our habits. We have to make sure that the risk factors are detected on time and they are controlled in a enough way. And that is what is the permanent cure. Can't we stop medicines once started? Possible. So young people who are not suffered from heart attack come to me for the first time and they say, Doctor, I am just 39 and my BP is remaining high. I'm having headache, but I don't want to start medicine because I will be dependent on medicine. That concept is wrong. We have to understand why. We have to assess, go to the depth, analyze why you are having hypertension first. Look into the reasons. There can be a treatable reason. There can be correctable factor which is leading to high BP. Correct it. Meanwhile, that correction works, stay on medicines because controlling BP is crucial. We cannot get let the person exposed to high BP. It may lead to IC bleed, a brain hemorrhage. Not acceptable. So we start medicine, work on understanding why this BP has gone up, correct that factor. And once the result of that correction is seen, the BP will come down. We'll reduce the medicine and we'll see whether you can do better without medicine. So I'm open to stop the medicine in a monitored way, in a step-by-step fashion, if we understand the reason for that. Okay, so it is possible to stop the medicine even for sugar, even for cholesterol, even for hypertension, if we follow a good lifestyle consistently, predictably. Thank you so much. So all questions are welcome. Yes, sir.
So thank you, Dr. Nagesh. I think all of us will agree that is an excellent talk. Yeah, any question?
Okay. So, sir, we treat all the issues step by step. As I said, your diet and exercise is the first step. semaglutide is a wonderful medicine. It is going to be a boon, but in select few cases. Have you ever seen a person taking semaglutide? The wife of that person goes in depression because semaglutide curbs your craving. आपका जो मोस्ट फेवरेट डिश है आपकी वाइफ आपके सामने रखेगी, आप खा नहीं पाएंगे. शी गोज इन डिप्रेशन, क्या हो गया इसको खा नहीं रहा है, कल तक तो बहुत अच्छे से खा रहा था, एंजॉय कर रहा था. सो इट इज फॉर सेलेक्ट फ्यू, इट इज फॉर मेडिकल रीजंस. डोंट टेक इट फॉर कॉस्मेटिक रीजन. I want to have flat tummy. I will run every day. I will make sure that I'm not eating that extra spoon of the ice cream. I'll make sure that I'm not eating high in glycemic index food. I'm eating before 7 p.m. I'm not eating in the midnight. If it works, well. Otherwise, at the end of 3 months, 6 months, we are open for an idea to initiate that therapy, but not at first go. Semaglutide is a wonderful medicine for medically indicated people who are suffering already from heart attack. Joints are gone because of weight of 140 kg. It is for such people where they are not able to mobilize because of the joint issues. They are not able to get motivation enough to control the food. There we use it.
So thank you, Dr. Nagesh, for an excellent
Doctor,
talk.
one question.
And who is it?
Yeah.
Somebody, yeah, Pandurang Bol.
Yeah, if you don't mind, Doctor. Yeah. Doctor, thanks for an excellent talk.
Thank you, sir.
You touched upon several aspects which one could relate to oneself. And I'm not elaborating on that. I'm just elaborating on two things I picked up from your talk. One concept was TOFI, TOFI, which is very, very critical and most of us miss. Related to another thing which you showed in this slide, hidden visceral fat. I'm a non-medical person, you're a medical person, and the whole panel is there. And we are fortunate to be in a gathering which is Chambur Gymkhana, which is rather well-to-do with people who understand things. My request to you is, if you feel, and there was a question from a lady, how do you detect visceral fat? And this I learned because I had an issue and I had to do it. I learned that in addition to what you mentioned about BMI and BRI, which are excellent, would it help if the Gymkhana actually bought a machine for body composition analysis, which will actually give the details of hidden fat and tell if you are a person suffering from thin outside, fat inside toppy? If it will help, I would request you as part of a medical panel to recommend to the Gymkhana to have it because it can be useful to patients.
Very excellent question, sir. I would like to answer this. So, just one question to you. Where do you stay, sir?
Yeah, nearby Devnar.
Near
Devnar.
Devnar. So, my question to you is from Devnar to Chembur Gymkhana, will you take a helicopter every day?
No.
So, we look at the cost benefit analysis. Okay, we can have all high tech, most fascinating machines. We can have MRI also to detect the visceral fat. That is the best machine. But is it cost effective? Okay, because simple waist hip ratio is going to give a pointer ki boss, you are likely to have visceral fat is more than enough. Then it cannot be generalized at mass level having a machine like because ultimately it is not going to tell us different than what we are looking at WHR, BRI and TYG. These are the three things which are simple. So if we do a cost analysis, maybe not a good idea to implement as a mass level because we don't take helicopter from there to here, no? We use a simple car or a taxi or a metro. So it is, we have to look into the cost effectiveness, sir. You can have it. There is no limit for going to the higher end of machines. Thank you.